Hello and welcome to Sex Ed Sundays with Dr. Sonya Maya. That's me. This is a channel where I'd like to talk about sex education. We talk about sexual health on here, psychology, facts, and relationships. And today I want to talk about 3 reasons that everybody should be paying more attention to their pelvic floor muscle health, as well as Kegels. How you can implement Kegels into your life in a way that can not only help your health, it can help your sex life, and it could also help with your psychological well-being. Please make sure to like and subscribe and turn on bell notifications if you love learning more about your body and ways to improve your psychological health. Let's do it together. By the way, if you struggle with anxiety, I want you to know your brain is not broken. It's a very normal part of the human experience. It's just unfortunately, a lot of us have anxiety in times when there actually isn't a threat. The problem is, even though it's a survival mechanism, sometimes our brain doesn't know the difference between an actual and a perceived threat. More on that later. Number 1, let's talk about ladies first. Ladies and vulva owners. Why are Kegels so important? If you practice Kegels regularly, it helps make your pelvic floor stronger. And this is a good practice in general. The thing is, your pelvic floor, it holds your uterus, bowels, and bladder in place. Any weakening of the pelvic floor can make it harder to hold in urine. Your pelvic floor is very much related to your ability to pee when you want to pee and not pee when you don't want to pee. It's very relevant when it comes to reproductive health. It turns out that a lot of people, after they have a baby, they might have a hard time with incontinence, meaning uncontrollable bladder issues, which you definitely want to avoid. Very importantly as well, of course, I gotta talk about this given that I specialize in sex therapy. When you practice pelvic floor exercises, it can really help you experience more pleasure and better orgasms. Any women who struggle with vaginismus or any other pain during intercourse may very much benefit from strengthening their pelvic floor, because a lot of the time pelvic floor issues can lead to pain during sex. Over time, women start to lose control over their bladder function, leading to leakage. So this could be related to age, it could also be related to weight gain, and it could also have to do with pregnancy, like I mentioned. As I was doing more research, I was actually looking into the podcast by the Vagina Rehab Doctor. She has a lot of really good information. I was using Spotify to listen to her, but yeah, definitely check her out. She explained, pelvic floor literally keeps us from peeing ourselves when we sneeze or cough or jump up and down. That is the difference between us peeing every time we go psh, achoo. Can you imagine? That would suck. When it comes to Kegels, what does that actually look like if you don't already know? The short way of putting it is you want to clench your vaginal muscles for 5 seconds. You're going to count in your head. Think about it like this. You're squeezing your vagina up and in, but you want to make sure that you're not squeezing or engaging your other muscles while you're doing this. You want to just be focusing on up and in with your vagina. For some people, it feels like holding in pee. For other people, it could be like the feeling of holding in a fart. And once you get it down packed, then it feels more normal. You want to squeeze it up and in for 5 seconds. And then after that 5 seconds, you want to release for 5 seconds. You want to do it about 10 to 20 times at once. And according to my research and doctor recommendations, 3 times a day can be pretty healthy when it comes to Kegels. And don't forget to breathe while you're doing it. So you can breathe in while clenching and breathe out while you are unloading. Not unloading, but you know, when you are untensing. Relaxing. According to my research, it can sometimes take about 4 to 6 weeks for you to notice benefits in terms of better pelvic floor health, whether that's better orgasms or being able to manage your bladder problems better. There are also pelvic floor physical therapists that some people can work with if you're struggling to do this on your own. I would suggest trying on your own first to see if you can manage it, because that might not be accessible for everybody, but it's something to look into if you want extra support. And I'm gonna put a very interesting study below. Recent research, I believe it was from 2020, shows that if you have more orgasms and you do Kegels, that's when you get the best results when it comes to pelvic floor health. So you want to be having a lot of orgasms as well too. It really depends from person to person, but from my research, I would say at least 3 a week in terms of orgasms, and then do Kegels multiple times a day if you can. Maybe just start off every other day. I'm going to do 10 reps of Kegels. Number 2, let's talk about men and peen owners. How can doing pelvic floor exercises help with men's health? As I've talked about in a lot of different videos, pelvic floor exercises are very helpful in strengthening the muscles that support the bladder and, for men, ejaculation. This means that if you struggle with premature ejaculation or performance anxiety in general when it comes to the bedroom, pelvic floor exercises can give you that extra degree of confidence that you can actually control how fast you come. And for some people, erectile dysfunction is related to performance anxiety, so pelvic floor exercises can be helpful if you're having a hard time getting hard as well. Strengthening that pelvic floor, better control of ejaculation, and it's very similar to what I just talked about with women. So you want to tense those muscles that you use to urinate or to hold back urine for 5 to 10 seconds, and then you want to relax it for the same amount of time, so 5 to 10 seconds, and you want to do this several times a day. Pretty much the same for men and women. And then I want you to do what we were just talking about, but while you're lying down. So 8 to 10 reps of the following. You're going to hold in that feeling as if you are trying to not pee, or hold in that feeling of I really don't want to fart right now, that kind of muscle clenching for 5 to 10 seconds, and then release. And then you want to try that about 3 to 5 times a day. See how you feel after week 4. Are you able to better control your orgasm? And if you are looking for other ways to control premature ejaculation, you can check out my other videos on that. I've definitely posted a couple in the past on premature ejaculation, lasting longer in bed, and so on. And if you take a look at psychology and you're wondering, how am I going to remember to do these things? We are very habitual creatures, so if you add it to your daily routine, this can be really helpful. The cool thing about Kegels, you can do them while you're doing something else. So maybe I'm doing some Kegels while I'm brushing my teeth. Maybe I'm doing some Kegels in the shower. Maybe I'm doing some Kegels at the gym. I mean, you don't want to fart or pee your pants in the gym anyway, right? So think about it like that. And nobody knows that you're doing Kegels, which is pretty great. And that brings me to my third tip of why it's so helpful, especially because people don't know that you're doing it, but you can actually use Kegels and pelvic floor exercises to manage anxiety. Let me explain, because this is so cool. I want to teach you about vagal nerve stimulating skills that can be used to manage anxiety. It could be used to manage trauma responses or distressing emotions in general. If you haven't heard of the vagal nerve is really important. It helps your body get away from fight or flight mode. Your vagal nerve takes 3/4 of the nerve tissue in the parasympathetic nervous system, which is the rest and digest part of the nervous system. This is the longest running nerve in the body. And here's a little reminder from psychology or biology. You probably heard about this before. Your sympathetic nervous system, fight or flight. There's a bear, I'm either going to fight or I'm going to run out of here. Some people say fight, flight, or freeze because your fear response can be to freeze too. Parasympathetic is the chill, relaxed, rest and digest. Mindfulness. Vagal nerve controls your heart rate, digestive system, and immune response. So I'm going to talk about vagal nerve exercises that can be so helpful, and they do involve the pelvic floor. As a reminder, anxiety has a function, of course. It is just a nervous system state. Anxiety can be helpful for survival. It doesn't define you. A lot of people that have generalized anxiety disorder might actually identify with anxiety, but it's just something that we all experience. And unfortunately, like I mentioned earlier, our brain doesn't always recognize when there actually isn't a threat. And when there isn't a threat, this is the time when it's safe. And it can't do any harm to relax our nervous system. Trauma survivors, unfortunately, a lot of the time, their brain still feels that they are in danger when they're not. It is very difficult to tell the difference between danger and stress. Am I actually in danger right now? Your brain thinks that you are, but you're not. And your body follows along. This type of skill can be used even if you're not having an extreme panic attack, for example. Let's say someone says something that triggers you and you just don't want to be controlled by that emotion that follows. We might logically know that we're not in danger when someone breaks up with us, or somebody's firing you, or you think you're gonna get fired. People that experience trauma, they might logically know that fireworks or loud noises aren't actually going to put them in danger, but unfortunately the brain doesn't know the difference. Even though negative emotions can feel somewhat debilitating at times and overbearing, the good news is that you always can use self-regulation in a way that addresses the nervous system. Bottom line, we hold a lot of stress in our pelvic floor, this area right here. With pelvic floor exercises, you can improve your vagus nerve overactivity. So let's talk about an exercise that involves the pelvic floor muscles. And I learned this by Dr. Eric Gentry. I'm gonna put the video below if you wanna watch more breakdowns of other skills that you can use, but we're talking about pelvic floor exercises and Kegels in this video. That's why I wanted to share it with you. When you bring relaxation to your pelvic floor and stop squeezing those muscles, and we don't even realize that we're doing it. When you learn how to relax your pelvic floor, this can really produce a potent relaxation response with the rest of your body. This is a skill that he taught. What you first want to do, here are your hands. You want to put your hands under your butt. So I'm going to do it right now. So put your hands under your butt and you want to find your sit bones. These sit bones are called the ischiatuberosities. Ischiatuberosities. Might take you a while. You might have to wobble a little bit if you're bootylicious like myself, but once you find these sit bones, you want to feel them with your fingers, okay? Once you find those bones in your butt on each side, you're now aware of where they are, and you can create somewhat of a felt memory. So you have a focus and sense of where they are just by touching them, okay? So like a touch memory. So now we know where they are. Great. You can remove your hands from under your butt. Now you're gonna touch your pelvic hip bones. They are called the bilateral anterior superior iliac spine. Yeah. So that's right here. Your pelvic hip bones. You might have a lingering sensation of when you touched your hip bones. Now you probably have a lingering sensation of when you touched your sit bones under your butt and touching your pelvic hip bones. While sitting in a relaxed position, imagine connecting the dots between each bone, like a square. And he shows this square right here. Imagine a line connecting from your hip bone to your sit bone, creating a square-like shape in your mind. Imagine a square like SpongeBob once you connect the dots in your mind with each bone. Then, allow each side of the square to expand. Soften that area of your body. Completely release everything in that area. That's your pelvic floor. Now you have parasympathetic dominance, and how he describes it, you cannot experience stress when your pelvic floor is relaxed. And the cool thing about it is when you relax your pelvic floor and you allow that square to expand, the rest of your body follows along with the relaxation. And it's impossible to be struggling in that panic mode when you achieve this. And it might take practice, might feel weird at first. I actually somewhat rejected it the first time. I had to really practice in my mind and really find where those bones were, because there's no other circumstances in my life where I'd be finding these bones or touching them or even knowing what they're called, and the words are really complicated for no reason. Yeah, when you're stressed, try noticing these muscles, creating that square in your brain, noticing when you're clenching your pelvic floor. Notice it. You can get total body relaxation, and there's also no wrong way to do it. You can even start by just relaxing any tense muscle in your body. So maybe my back's a little tense. You want to mindfully acknowledge, okay, it's tense, I'm gonna relax it. That's a correct way to regulate your emotions. In order to practice pelvic floor exercises like Kegels in a way that helps you with anxiety, I want you to lift up your pelvic floor muscles for 5 seconds, like I talked about earlier, okay? While inhaling, 1, 2, 3, 4, 5. And then you wanna exhale for 5 seconds. And when you're in that moment of the pelvic floor relaxing, I want you to just notice how the rest of your body goes along with that pelvic floor relaxation. This exercise is referred to as vagal nerve therapy. And when you exhale, this activates the vagus nerve, which is why it's so important to remember that you have to exhale out of your mouth for longer than you're inhaling, because that relaxes your nervous system. I've also learned that it's really important for us as therapists, if you're a therapist too, to learn how to relax our vagal nerve and our nervous system before sitting with a client. A lot of the time our clients can tell when we're stressed out. It's hard to hide it, especially if we have like a super observant client, for example. There's this aspect called mirror neurons you might have noticed before. For example, you walk into a room where everyone is stressed out, you're gonna feel the stress. You walk into a funeral, you're gonna feel the sadness. And your therapy clients can sense when you're uncomfortable or when you're stressed. So it's really important for us to learn as therapists how to relax our senses in order to be the most present and not to bring our own stressors into the room whenever possible. Thank you so much for watching this. I hope you learned more about your pelvic floor muscles and how to relax them and how to apply this research to improving your psychological well-being, your sex life, your relationships, your ability to keep your pee in your bladder when you want to. Please make sure to like and subscribe and turn on bell notifications if you like content like this. I did leave some resources below, and I'll see you next week for another Sex Ed Sunday video. Thanks for watching. Goodbye.